Hello, and welcome to the Hippie Martha Hormone Hour. I'm Ashley, your host, and today we are talking about something that affects far more people than we realize, and that is early pregnancy loss or miscarriage. Now, before I begin, I want to gently offer a trigger warning to you. I'll be speaking openly about pregnancy loss. You will hear words like products of conception, termination, bleeding, placenta, uterus, cervix, and other various reproductive parts, and talks about hormones. If today is not the day for that, please honor yourself and pause here. This episode will be waiting for you when and if you're ready. Please honor your own needs as they are important. If you are wanting to understand and learn more, keep on listening. I also want to put out that I am not a physician and cannot treat or diagnose you. If you have any questions or emergency needs, please seek out medical help. If you need help talking through things, I would be happy to provide that support via a private consultation with myself. I also want to give credit to my cohort at the Wells School of Body Literacy for all the information I have learned and am sharing with you today, especially Nina Britton, who provided me with all the references I share today. And if you would like, I can share them with you as well. So let's continue. Most of us grow up believing miscarriage is something rare or something that happens to other people. But the truth is, 15 to 30% of pregnancies end in miscarriage, most of them in the first trimester, and we don't even notice that they are happening. That means almost 1 in 4 women will experience it at some point in their reproductive life, and yet we don't talk about it. We're sent home with, "It just happens," or "try again in a few months," without ever truly being told why. So today, in this podcast episode, I want to explain early pregnancy loss in plain language, what it is, why it happens, how it's diagnosed, and what your options are if it's happening to you or someone you love. So first, let's start off with, what is early pregnancy loss? The definition is early pregnancy loss is when a pregnancy ends naturally before 13 weeks gestation. So about 80% of miscarriages happen during this window before that 13-week mark. Most of the time, it's the body's way of releasing a pregnancy that wasn't healthy enough to continue. Our bodies are so intuitive, and they know when something isn't right or isn't going to sustain. Now, around half of all of those miscarriages are typically due to chromosomal issues, meaning something in the egg or sperm didn't line up correctly. Nothing you did caused it. Nothing you could have done would have stopped it. In my experience, this is exactly what happened during my miscarriage. And if you want to hear my story, go back and listen to the first part of the miscarriage story. This is part 2, and then there will be a part 3 that we'll talk about in a little bit. So besides chromosomal issues, there are other factors, and these things we can talk about. So these are things that we want to look at when we are trying to conceive to have a healthy conception. So this is that time where we want to plan for conception and things that we can do to kind of help prevent these chromosomal abnormalities from happening or from having early pregnancy loss. Factors include hormonal imbalances, for instance, low progesterone or thyroid dysfunction, insulin resistance or blood sugar issues, uterine abnormalities, fibroids or cervical issues, infections or autoimmune concerns, and then there's environmental exposures such as smoking, alcohol, or even high caffeine intake. Aside from those, we have recurrent miscarriages, which is defined as 2 or more losses in a row. So after the second miscarriage, the risk of another rises to about 28%. And after 3, it rises to over 40%, which is why deeper investigation is needed, not just a try again. So from an emotional standpoint, loss in early pregnancy is actually very complicated. Not only do people who experience it feel deep grief, but others almost feel shock, guilt, numbness, or sometimes even relief. There is truly no right way to feel, But I will say this, if you experience loss, it matters. Whether your baby was 6 weeks or 16 weeks gestation, it counts. You don't have to earn your grief by reaching a certain milestone. The next thing we're going to talk about is how miscarriage can show up. So I'm going to list the different types of miscarriages, and you may have not even known that there were different types. Just a loss is a loss. And if you want to continue thinking like that, that is totally okay. But I do think that it's important for you to have a simple breakdown of what each miscarriage is, because then you can advocate for yourself if you experience or are going through it. And so the first one I want to start with is called a threatened miscarriage. So a threatened miscarriage is where you will have spotting or cramping, but there is still a heartbeat present. About half of these will resolve about half of pregnancy. The next is called an inevitable miscarriage. Inevitable meaning it's going to happen. An inevitable miscarriage is where you will have bleeding and cramping with cervical dilation, and the body is actively releasing. The next is called a missed miscarriage. This is where you will have no symptoms at all. That includes no heartbeat being found at the appointment. Now, a lot of times miscarriages aren't even detected. We don't even know we're miscarrying because the bleeding will come just like a period. And so a lot of these are essentially missed, which is why it is called that. Next is called an incomplete miscarriage. This is where you have an inevitable miscarriage where bleeding and cramping with cervical dilation is happening, but not everything has passed. And, you may have prolonged bleeding, you may be passing some pregnancy tissue, or you may not have anything, but you had at one time a positive pregnancy test, could never find a heartbeat, and this is just the body's way of being unable to fully pass the products of conception through. The final one is a complete miscarriage. And let me go back to incomplete miscarriage, because an incomplete miscarriage can actually be the most threatening to the mother. And this is because bleeding can become very heavy. Tissues can adhere to the uterine wall and the uterine lining, and the body just can't expel it. So this is where hemorrhage comes in play. This is where you really need to seek out treatment, because a lot of things can happen during an incomplete miscarriage. For instance, infection, heavy bleeding, hemorrhaging, all of those things, okay? And finally, we have a complete miscarriage. This is where everything has passed, bleeding slows, and our hormones, our HCG levels, our progesterone, all of that is lowering, and our body is moving on and moving forward. Now, like I said, understanding these terms can help you advocate for yourself when you are navigating care. And every physician deals with this differently, as well as depending on where you live. If you are living in the United States, there are different states that have different ways to treat and care for miscarriages. And if you really need to advocate for yourself, I have plenty of reference material for you. Thankfully, I live in a state that can treat all sorts of miscarriages. You may live in a state where that is not possible. And I do want to point out that there have been mothers who have lost their lives because they haven't been able to be given the care that they needed. And so I want to just put that out for you, that if you need some sort of information, please reach out to me personally, and I can kind of help you navigate that care for yourself. So talking about care options, depending on how your miscarriage is presenting, you usually have 3 options. And I believe that you deserve informed choice in all of them, meaning you need to weigh out what is going to be best for you, okay? What aligns with you whether that's spirituality, whether that's protecting you as the mother in your own health, whatever it is, I want you to understand that you do have options. The first one is what we call in the medical community expectant management, which is basically watchful waiting. This is where you know it's happening, you're letting your body release it naturally. And while this can maybe feel more natural and private, it can take many days or even weeks before the process actually comes to a close. Now, like I said, this can maybe feel very natural and private, and it may align with your beliefs and what you want from your body, okay? The second is medication. So we talk about, sometimes in the labor and delivery community, we talk about inductions. And being a labor and delivery nurse for over 10 years, I have used this medication numerous times. And this medication is called misoprostol, also known as Cytotec. Now, this medication helps the body move through the process more predictably. It causes cervical dilation, stronger cramping or contractions of the uterus. And typically when someone takes this medication, they are often releasing the products within 24 to 48 hours. Now, this doesn't come without its risks. With all medication, I highly encourage you to ask what complications can happen. I personally know that if used too much, or depending on where it's placed, or how it's used, you can have a higher risk of bleeding or hemorrhage. It can also cause tissue degradation because it literally causes the cervix to dilate and make the cervix almost kind of like mushy, okay? And it softens the cervix so that the products can easily flow through. Moving on, we have the last, which is surgical, okay? So we have what we call aspiration or a D&C. And this is a slightly minor procedure. And what they do is the doctor will go in, you will be sedated, and the doctor will go in through your vagina into your cervix and will suck or scrape out any products that are in the uterus remaining. Sometimes this has to be used while we have tried to use expectant management where we're trying to do this naturally and our body just won't let go. This can also be used, especially if there is an emergency. Now, D&C is typically recommended if there is heavy bleeding, infection, or someone just wants to not wait and move on. But I will say that for most physicians, this is like the last thing that they offer because it is a surgical procedure. I do want to say that none of these choices make you stronger or weaker. They are just different forms of care, and you just deserve to understand them. So after the miscarriage, there begins a process of not only physical healing, but emotional healing. The physical healing usually takes roughly 4 to 6 weeks for your body to recover, especially depending on what option care you chose. But I do want to say that emotional healing has no timeline. Ovulation can return as early as 2 weeks after the event took place. And so contraception and or conception planning matters rather quickly at this point. And if you plan to try again, this is where I come in as a fertility awareness educator. Because yes, sometimes miscarriage is random, but not always, and you deserve to know the difference. If you work with a fertility awareness educator or someone who is knowledgeable in this field, we will be working on things that include what your cycles look like. Is there spotting before your period? Are you having short luteal phases? Do you have strong temperatures? Or are they subpar? All of these signs can lead to progesterone deficiency or hormone imbalance long before a positive pregnancy test. And if we treat the root cause now, we might be able to prevent you from having recurrent miscarriages. Remember that your cycle chart is not just tracking from period to period. When you are tracking ovulation and understanding what is happening in your body, in marking down cervical fluid, in basal body temperature, and when you're having intercourse, this is information. It's also prevention and it's peace of mind. And I also feel that sometimes charting your cycle can not be good for some. And if that's the case and you're in this, you don't have to walk through this alone, but also understanding and knowing what happens to our bodies afterwards and what we can do to prevent that can be very, very helpful. So if you've experienced loss, I want to honor you. If you're walking through it now, I just want you to know that I am holding space for you. In the next episode, I'm going to be diving into hormones and talking about specifically progesterone, which we know it as the pregnancy hormone. We are going to be discussing what progesterone does, why it matters, and how to advocate for proper testing and support. So make sure that you're subscribed and don't miss out on it, because this is one way in which you can help to support your body and hopefully understand what is happening during these times of loss. Remember that your body is wise, your grief is valid, and there is hope even after loss. Thank you for listening. We'll see you soon. Take care.